All right. Good morning, everybody. Thank you so much for joining us this morning for our quarterly information sharing session. My name is Chad Allgood. I am the director of the Division of Early Childhood Care and Development, and we are at the Mississippi Department of Human Services. I think, gosh, we've been doing these information sessions for, several years now, and I think they've been really great opportunities for us to share information and also allow you all to ask questions of us so we can clarify things and give us an opportunity to give you all information that you all need. Also, just a couple of housekeeping tips for anyone that's new to the sessions. So what we'll do, we're going to take a few minutes at the beginning of the session. We're just going to share some general updates from DECCD. And these are general updates that we share with everybody. And then once we have finished sharing our um, updates, then we will give you all an opportunity to ask questions. Now, the way that we do this, because we do have a lot of people that are in the session, to kind of cut down on some of the interruptions because we only have an hour. We do ask that when you do ask a question, if you'll just put it in the chat, and then we will go through the chat and we will answer those questions. I am going to refrain from repeating answers to questions that I've already answered. We are recording the session, and again, just in the interest of saving time, we do record the session. So, and though we make that available to folks to go back and watch. So, if I've answered a question in the session, I'm not going to go back and repeat myself multiple times. I may answer it once or one more time, but again, just in the interest of saving time. When you ask your questions, the questions need to be general questions. We do not answer questions that are specific to a certain center or a certain family. If you have questions that are about your program, specifically about a certificate or an issue that you are having at your specific child care center, if you will either utilize our hotline or our CC payment email address, and use those methods to get any of your questions that are specific to your program answered. If I do not have an answer for you today about certain questions, we'll work on getting those answers and getting those answers out to you by the next information sharing session. Or we also have our CCPP Advisory Council. We meet with them each quarter. You can get them your questions too that they can relay to us. So anyway, with that in mind, I'm going to go ahead and get started. The only other thing that I do want to say is just as a reminder, these sessions are recorded. So anything that you put in the chat is subject to public view. We do ask that everyone be very respectful of each other if we're sharing ideas, etc. All right, so that being said, I'm going to jump into the updates. So one of the first things that we wanted to do is just remind everyone about what's going on regarding redetermination. As most of you are probably aware, last year we put a temporary pause on redetermination, just in the effort to get our service numbers back to a level that we could handle. Effective November 18th, and that was November 18th of last year, we did get to a place where we had called back enough where our numbers were in alignment with what our normal budget could sustain. And so, effective November 18th, we did reestablish or reinstate redetermination for families that currently have certificates. So, what that means is any families who had not received a termination notice prior to November 18th should receive a redetermination notice, not a termination notice. Now, if a family had already received a termination notice prior to November 18th, then that termination notice would stand. So this was only for anyone that had not received a notice after November 18th. Now, we've had a couple of instances where providers and families have said that they have received a termination notice after November 18th. So if you have a family who receives a termination notice and they believe that it is by mistake, please contact us again via the email at ccpayment or call the 1-800 number. We will look into it. We will correct that issue if the system sent out a termination notice by mistake. So please have those families if they received a termination notice after the November 18th and they were eligible for redetermination instead, just have them reach out to us, like I said, via our email address or the 1-800 number. We will look into that and correct it if the termination notice was sent out by mistake. Also, in addition to the reinstatement of redetermination, we are looking at our certificate numbers pretty much daily. As we have new space, as we have families that roll off the program, and we have space for new certificates, we are going to our waiting list and sending those families individualized application links to go in and apply. And we're, like I said, every week as we're doing that, we're watching those numbers closely to pull from our waiting list as quickly as we can. Something else that we wanted to make sure that we mentioned was that we had a policy change. We updated our policy manual. We're working on getting the updated policy manual out on our website, but we are now one of the big policy changes that we made. We are now accepting both individualized education plans and individualized family service plans as part of issuing a certificate for a child that has special needs. Previously, we required that a child have an SSI determination before they would be considered for a special needs certificate. So we have updated that policy. If that child has an IEP or an IFSP in place, that documentation will be sufficient for that child to be issued a certificate for special needs. Now, a couple of things to keep in mind. The IEP or the IFSP, that cannot just be created by anyone. A real IEP or a real IFSP will be issued by the local school district that is providing those services to that child. So the local school district, when a child reaches the age of 3, if the child has been identified as having special needs, the local school district is required by law to provide early intervention services to that child. And what they will do is there will be an IFSP or an IEP that is giving that is that will be given to that family. Another thing to keep in mind is so I've heard feedback from early childhood programs and that are saying that people are showing up to provide early intervention services, and y'all really haven't been given any, advance notice. I've been talking with the First Steps leadership at Department of Health and have been urging them to make sure that all of the early intervention providers that are providing services across the state that they're involving you all up front in the IEP or the IFSP meeting prior to um, prior to the person showing up to provide those services. Um, so anyway, just something to keep in mind. I do think it's very important that a child that's receiving early intervention services at the child care program, the director and the teachers, they need to know what that process is going to look like and how they can best facilitate those services for the child. So I did get a question really quickly, and it is pertinent to this particular topic. So if early intervention, so like First Steps, if they issue an IFSP, would that be acceptable? I believe they may possibly can issue an IFSP. If that's the case, then yes. It has to be from an entity that can issue an IFSP or an IEP. It just can't be just anybody. And just know that when an IEP or an IFSP is submitted as documentation, we will be following up with the entity that issued it to make sure that it's valid. If any documentation, of course, that is submitted as that has been falsified, that will result in the removal of whoever was connected from the CCPP. The attendance, another policy, and this is not a new policy, this is just something we've had a couple of instances where with our monitoring where we've run into this issue. Regarding attendance records, so just as a reminder, attendance records, and I'm talking about sign in and sign out sheets, they must be kept on site and made available upon request to our monitoring staff. It is our policy that you should retain sign in, sign out sheets for a period of 3 years. And if at any point, if at any point that you close, federal law does require that you submit at least 3 years of sign in, sign out sheets to us. That is a federal requirement. Now, one thing that we kept running into because there is software out there. Procare is one that I can think of. Brightwheel is another. Um, there's other software out there that that has like a system that captures digital signatures. So those systems are okay. We've updated our policy manual to make sure that it is clear that you can utilize those systems. Now this says it has to be approved by child care licensing. So y'all know that child care licensing, they require you all to keep attendance records as well. But as long as part of the licensing process, you're using a system and your licensing official has said that that system is approved to use. By the way, things like Procare, Brightwheel, et cetera, those are approved to use. You can use those in lieu of your paper sign-in, sign-out sheets. You just have to be able to provide a record of the attendance. So what that means is, if monitoring shows up, you just need to be using a system, and the ones that I've mentioned actually do that. They can produce a record of attendance. So that those types of attendance systems do not require the parents to physically sign in and sign out with a pen or a pencil. So just know that if you're using one of those systems, that's okay. If you have a system and you're not really sure if it's approved, where you would not have to do the paper sign in, sign out sheets, please just let us know. And we'll look into whatever the system is and see if the records that the system provides are going to be adequate. Also keep in mind that if you are just creating a computer generated spreadsheet, so like if you go into Excel and you're creating you're creating a sign in, sign out sheet just on your computer, that is not an electronic attendance system. Okay. It has to be an actual system that captures those digital signatures. Angela, did you want to say something? I saw you had your hand up.
Yeah, back on the SSI one, good morning after everyone. I just want to let everybody know that for the IEP and the IFSP, they need to use the special needs option when the parent go in to apply, and the parents must meet the requirement. So they still must be working or in school, or one of those categories to for that to continue. And so it's because the IEP and the IFSP is falls under the special needs category, so that's why you need to go that route. So if it's asking you any other question, I see Sheila Lowe says it's asking you something else. So just put 0 if it's SSI, but it should be a drop down, Miss Sheila. But I'll go back and look at it. But parents still must meet the requirement on that one. So I just wanted to make sure that I said that in redetermination, when you mentioned that one, parents do not have to fall in any category for that one. They could be working or in school. The 6 6 categories is only for if it's a new application, and they meet one of those categories. Redetermination is totally different. They could be working in school, combination, special needs, whatever. So I just wanted to make sure I clarified that before we went any further.
Thanks, Angela. Okay, so again, with the attendance records, just we do require that you have attendance records. If you're using a system that captures digital signatures and it's been approved by, licensing, and like I said, most of the major, systems that are out there, they are completely okay to use. And if you do have a question about, a specific type of system, just reach out to us and just to see if the records that the system provides are going to be sufficient. Something else that we wanted just to remind you all about is co-payments. We've had a couple of instances where providers have not been charging co-payments or they've been waiving co-payments, or we've had a couple of instances where the provider was not able to really provide a record of collecting co-payments. So the co-payments, that is the amount of a co-payment is established when the family applies and is approved to receive a child care certificate. Even though, child care, you all are collecting that co-payment, co-payments are part of the agreement between the family and MDHS. So it's the best way that I can describe a co-payment. It's kind of like if you go to the doctor and you have a co-payment. Even though you have an insurance company that, pays for part of your services, like when I go to the doctor, I still have a copayment, regardless of my deductible or whatever. So that's kind of the same thing as what copayments are for families. Copayments may not be waived by a provider for any reason. If the family is required to pay a copayment, they must pay that copayment. Now, if you have a situation where families are not wanting to pay their copayments, we can assist you with that situation. That is not something that, again, that the copayment is part of the agreement between the families and us. We will intervene if we need to make sure that family knows they have to pay co-payments. There's also a form that's online. If you go to the DECCD webpage on the MDHS website, you can go in and there's a form that can be filled out if you have a family that's failing to pay co-payments. And Angela did put in the chat, so even in a foster care situation, the foster parent is responsible for the copay. If there's an issue, she's saying they might want to talk to the social worker, if the social worker is giving them other instructions, etc. MDA, the Child Protection Services may pay the copay fee for the foster family in certain circumstances, but that needs to be established by CPS. Okay. Um, so again, you cannot waive copayments for any reason, and you do have to maintain proof of copayment collection, and that needs to be separate from any other tuition payments. So like if you have, like an invoice like or a ledger where you're charging tuition payments, etc. Like for example, if you do require families to pay the difference between your tuition rate and the subsidy rate, if the subsidy rate is lower than your tuition, that's okay, but you just need to make sure that you're capturing proof of copayment separately from anything else. Like there actually needs to be on the family's, invoice or whatever where they made a payment, and the invoice needs to specifically say for copayments. That's just the best way that if our monitoring, folks come out and do a desk review, or if they are looking at copayments. So it's just the best way that you can show that you are collecting those copayments as required. We do not pay, there are 3 categories that are automatically not assessed copayment fees. So any families that are receiving TANF assistance, families that are experiencing homelessness, and families that are at or below the federal poverty line, we do not charge copayments for those families. One of the other things that I wanted to mention is just the kinship rule. This is something else that we clarified with our latest policy manual. There were some questions about kinship and what degrees of kinship were allowed versus what degrees of kinship were not allowed. So these are some clarifications we made in our policy manual update, this past one that we just did. So parents or guardians within the first degree of kinship cannot receive payment to care for their own child. So if you are a parent or guardian, you cannot receive CCPP funds to pay for your own child. So if you own so for example, if you own a child care center and you have children that are on the certificate, those children may not attend your center because you are their parent or guardian. Federal law does not allow us to reimburse parents or guardians for paying for their own children. And that's within what we call the first degree of kinship. Now, if you are a relative that is outside the first degree of kinship, this includes grandparents, aunts, uncles, cousins, etc., you may receive payment for providing services, child care services, to care for a child, but you have to, of course, meet the other requirements to be a CCPP provider. You have to be licensed, you have to meet, the Elevate requirements, etc. But if you are not within the first degree of kinship, you may receive payment through the child care payment program. Again, if you're an owner, you can care for your own child, but provided that child is not receiving CCPP assistance. Another question that came up is, what if you have, and this is a situation that's much probably more likely. If we have parents that work at a child care center, is that okay? So again, the parent can work at a center where a child is enrolled that is on CCPP, but that parent cannot directly care for or teach their own child. So if you're the owner of a center and you have a parent and a child that are on the child care payment program at your center, that's okay, but that parent, or excuse me, that child cannot be enrolled in that parent's classroom. The parent cannot directly care for or teach their own child. So just something, just something to say. Um, yes, that does apply to foster care children as well. If you are receiving a payment for a child that's on foster care and you own your center, that child cannot attend your center. That is not allowed. It's considered this, you are considered the guardian of that child or a guardian. There's a legal word for that. I can't think of it, but that's correct. If you have a child that is, it's a foster child, and you own the center, the child cannot attend your center, if they're on that. The last update that I wanted to make before we get into questions, we had launched online training for everyone last year. We did have to temporarily pause the online training because we needed to go through that. The contract with the previous vendor had expired, and state procurement required us to go back through the request for proposals or RFP process. Because this system involves technology, the Mississippi Department of Information Technology Services, which is a separate agency from DHS, they have to handle the RFP process. The RFP is live. It went live a couple of weeks ago. Right now, it's open. ITS is accepting proposals until March 11th of 2026. You can go onto the Mississippi Department of Information Technology Services website. There's a link to procurement, and you'll see there's a link for live RFPs if you want to go and look for that. In the meantime, our coaches are still currently offering virtual training to assist with your training, teachers receiving contact hours. You can register for those trainings with LiftEd, and the link is just portal.lifted.ms. So your teachers can still go online to register for training. And we'll continue to, of course, offer face-to-face training once we get a new system back in place. Okay, with that being said, that's all the updates that I have right now. We are going to open it up for questions. So if you do have a question, if you'll put it in the chat. and I'll answer the questions I can. I'm going to scroll back through. I know there were some questions that popped up. Let me just go up and see if there's anything that I did not answer. So one of the questions is, when do you anticipate the new policies to take effect? These new policies are in place right now. We are trying to get the policy manual on the website. Our communications folks are having some issues with some of the coding on the website, but these policies are in place. We're trying to get a workaround to get y'all the new policy manual so you can have access to it. We're trying to figure that out. If we can email it out to you all, we'll try to do something like that. But the policies are in place now. Let's see. Angela, thank you for popping answers in the chat also. Let's see, there's a question. When the daycare is picked and you find out that the daycare is not open, but the registration fee is sent to that daycare, what happens to the registration fee once you go ahead and change to another daycare? Does the registration fee transfer with the child? I believe the answer to that is no. Angela, do I have that wrong? Like if someone pays a registration fee to a child care center, do we transfer registration fees? Okay, hang on, I think she's still, you
Okay,
get,
yeah. For
yeah,
some reason, I was back muted.
okay.
So what I was going to say is, we have the ledger, so that if you have a child that is not yours or they did not attend, all you have to do is put A's in the registration code. I mean, the registration fee will not be paid out to anyone. It will follow the child at the first day of attendance at the center that they actually choose, and the provider is claiming payment. So if you claim payment, a FFP saying that the child attended at least one day, and you are due that registration fee, it will come up on your ledger. So I'm not sure if the child attended or not, based off of that question, but you can look at your ledger, and if the $50 is there, then you are paid for it. If the $50 is not, that means the child attended somewhere else, and maybe the center previous to that claimed it. So it just depends on what was listed from the previous provider. So I would have to know more to be able to tell you exactly. So you can send your question to CC Payment. I'm not sure who that is, and I'll be
Yeah,
happy
Mr.
to answer.
Dunmore, because Angela, the question is saying if the child care center is picked and then it's not open. I think probably the best thing in this case would be for you to contact us directly so we can look and see what's going
What's
on.
Mr. Dunmore?
Yeah.
Okay, that's fine.
Yeah.
But I was explaining the process. So even if
Mhm.
that child did not attend and that center was closed, the registration, once they claim F or P on the ledger, the registration fee will be computed.
Yeah.
So it just depends on if that registration fee was paid out already, like if the child was coming from somewhere, or so I just wanted to make sure that's clear. It just depends on the situation for the family and if
Yeah.
they've been on the program already.
Yeah. Okay. So there's another question. If my center charges more than what the state covers, will the state communicate to the center what their limit is? So I'm assuming when you say limit, you're speaking to the tuition limit. We actually do not establish tuition limits for child care centers. We do not have the authority, nor do I think we should have the authority to tell child care centers what they can and cannot charge. The only thing that we do not allow childcare providers to charge our families that are participating in the childcare payment program more than what we call private pay parents or parents that are not receiving subsidy. So the tuition rates just have to be uniform across the board. There cannot be different rates for non-CCPP and CCP families but we do not set limits on tuition rates. And again, I don't think that's really our place to do that. I don't think that we should be setting limits on that. If you're at a child care program where you feel that you're being overcharged, we do allow families to change providers if they feel that a situation is not best suited, for them. So there's a question about when will funding be available for parents. We do have available certificates now. As we have more spots that open up from our waiting list, we are going on the waiting list in order in which people sign up and giving them an individualized link to sign up for the program. So there's a question on February 3rd, Congress passed and signed an $8.8 billion increase. And then there's a what does. I'm not sure what the rest of the question is, Ms. Harvey, but if you want to finish your question, I'll answer that.
Yeah, they said, what does it mean for Mississippi?
Oh, well, I'm hoping that, okay, so the question was there was an increase of 85 million from federal fiscal year 2025. What does that mean for Mississippi? I hope that means that Mississippi, and it should mean that Mississippi will see a slight increase in our CCDF funding. And $85 million, that's a good amount of money, but also just keep in mind that that 85 million is spread out over all of the states and territories across the nation. And the way that the Office of Child Care determines there's an allocation formula for each state, and Mississippi gets a certain percentage based on that allocation formula. So hopefully that will mean we'll see a little bit more funding. Hopefully that we'll see a little bit more funding come our way with that increase, which that definitely helps. So that would have been great to have been 885 million, but we'll definitely take the 85 million. So there's questions about the waiting list. How behind is the waiting list? The waiting list is extensive. We're working to try to cull it. We're working to remove. We do have families that we've notified that have not gone in and applied. So we're looking at and we're trying to serve as many families off the waiting list as we have. But it is substantial. So. Anyway, it may take some time before we can get to those families. So there's another question about all trainings through LiftEd virtual. No, there should be some options for face-to-face training. It's also so Department of Health, they have trainings that they list on there as well. MECIC, they also have trainings, and some of our other partners that offer training. So there should be some face-to-face as well as some virtual options on the enrollment. I mean, on the trainings. So another question, enrollment, is it still enrollment based or has it changed to attendance based? We are still on an enrollment based reimbursement model. The federal government, with the 2024 final rule, required states to move to enrollment based reimbursement. Um, the federal government has since retracted that requirement in the proposed new final rule. We're waiting to see what the federal government asks states to do regarding enrollment versus attendance based. As I understand it at this point, they're not making it a requirement, but I will say the federal government is definitely there's a lot of talk around ensuring that states are in fact reimbursing for actual child care services or for families that are actually utilizing services. So just stay tuned. We're waiting on more information, more guidance from the Office of Child Care before we make a determination on that policy. Is there a certain amount of hours that childcare payments pay for? So we do not set time limits on our hours. We do have full-time and part-time certificates. A part-time certificate is anything that's less than 6 hours a day. A full-time certificate is 6 hours or more. Can we send in some names for you to pull off the list? No. We serve those families in order in which they signed up for the waiting list. So, um, or unless you're saying that they don't need to be on the waiting list, but either way, we try to call the list as we can. How soon? Let's see. Well, I'm trying to add in my child, but it's saying I can't add him unless he's special needs. So right now, special needs is one of the priority populations. If you have a child that is special needs and meets the requirements with the SSI determination, the IEP, the IFSP, and if you as a family, if you meet the work and the income eligibility requirements, you do need to apply as a child with the special needs. So that is an option that's available to you. So how soon we see this come our way? Ms. Harvey, again, the federal government. So once the money is authorized, the Office of Child Care, they set the allocation. I don't know. I don't know at what point they will increase the awards or how they will allocate that. Hopefully they do it sooner rather than later. But again, the Office of Child Care, they take the 85 million. They determine what the allocation should be across all the states and territories, and then they usually update our award letter. But hopefully that'll happen, relatively quickly. So it says for clarity, okay, well, Angela answered that question. Yes, we are issuing you certificates from the waiting list, but like I said, it is somewhat slow. Um, the other question, what is happening with the Elevate program? Is the deadline date for our first badge is still April 1st. We have been watching the numbers with the Elevate. We are going to send out correspondence to you all. You'll all get official notice from us with Elevate. We are going to extend the deadline for the first badges until October 1 of this year. With Elevate, the intention was never for it to be a burden or for it to create undue stress. And the main part of Elevate is the support that you all get. So, and while the badges, do represent working towards, meeting those best practice standards. The badges are not the main goal. The main goal is that y'all receive the training, the technical assistance, the support from us to help, to help provide the best care and education for your kids. So yes, we are going to extend the deadline for the educational interaction badge until October of this year, just to try to give more time for centers to receive the training, to be assessed as well. Let's see. If redetermination deadline is not met due to unsatisfied documentation and payment is collected, can the parent get reimbursed for fees paid while waiting for approval for the program? I'm not really sure. If you're talking about fees charged by the child care center? I'm not really sure. Angela, do you have any thoughts on that?
I'm sorry, Ted, I was answering another.
That's okay.
What did you
So
say?
the question is if the family has applied for redetermination, but there's documentation that's not sufficient, or in other words, the family does not successfully go through redetermination, the question is, can the parent get reimbursed for fees paid while waiting to be approved for the program? I think the answer is no.
No, we
Yeah.
don't reimburse.
Yeah, we can't go back and reimburse if the family does not have an active certificate. What about the parents that haven't had children yet? Do they need to sign up? I'm guessing you're meaning like for the certificate program. Um, if the parents want to go ahead and add their name to the wait list, if they're expecting, just know that they have to have the child, before they're approved for a certificate. You said earlier that if you received a termination after November, the certificate will be automatically reinstated. No, that's not correct. So what I said was, after November 18th, if the families that are eligible for redetermination should receive a redetermination notice, not a termination notice. Um, and the redetermination notices go out 60 days prior to the certificate expiring. Now, certificates are not automatically reinstated or automatically renewed. When a family receives their notice of redetermination, they have to go in and reapply through the redetermination process, which is it's a slightly expedited version of the application. It's not the full application, but they do have to verify information that they're still meeting the eligibility requirements, et cetera. But what happens is 60 days prior to the expiration of a certificate, right now the family should receive a notice of redetermination, not a termination notice. If the family received a termination notice prior to November 18th, the termination stands.
And I want to make sure that I also state that if they receive that termination notice and and it had a deadline date on it and it was prior to that date, I mean, we'll look at the case if you have one that you feel like it should be looked at, but please make sure that if you received a termination notice for that family, then that's ruling is probably going to stand, but we could most definitely look at it and make sure that all the steps were taken, like Chad said. So I just want to make sure I say that.
So there's some questions about what do parents do if their certificates were terminated. Unfortunately, the best advice I have is to sign up for the waiting list. Look at other options that may be available to you. I will say this, so there's some comments that say you took all of my certificates. Um, I do want to point out that um, I personally warned against the cliff, not once, but twice. In November of 20, well, it was actually October of 2022, and then November of 2024, I testified to our Senate Appropriations Committee. It was actually the Senate, was actually the Committee on Women and Children about the fact that the pandemic funds were going to be used and there was going to be an expiration date and we would not have them anymore and that we would have to realign our budget with our normal numbers. And I gave a very specific number to our legislators and said, we need, at that point, it was $47.9 million to not have to cut children from the program. And we did receive some funding from the legislature. We received $15 million, and I'm grateful for that. But I will say, DCCD did not take certificates. We did not make a decision to say, okay, you can't have a certificate, you can't have a certificate. But we did have to realign our budget with what our normal funding could supply. If we had not done that, we would have run into a situation where we would have run out of funding before the year was complete, and then no one would have received payments. We did what we needed to do to be responsible with the funding that we had access to. And I will say that every chance that we get, we have conversations about more funding for child care certificates. I understand, there are a lot of families that are in very difficult positions right now. This is not unique to Mississippi. States all across the country are experiencing this same issue. States are looking for solutions. We have many people who are speaking out on behalf of the Child Care Payment Program and talking about how valuable the Child Care Payment Program is and that more funding for it would lead to more families not only having access to high quality education for their children, but also just being able to go to work. And so I will say I greatly appreciate those of you that are speaking up on behalf of the Child Care Payment Program and just letting folks know how crucial the program is to serving our families with our kiddos. So please, please keep that conversation going. It's incredibly important. It says that we've already obtained our credential per Elevate when we start to get our quality payments for having gotten our badges. The only badge you should have gotten at this point is the Educational Interaction Badge. We have not, to my knowledge, awarded any of the other badges just yet. We are focusing on making sure all programs get that first badge first, just because that first badge is a requirement to participate in CCPP period. There are no additional payments associated with the first badge. We are getting closer to launching the second round of badges, and once you start earning those badges, there will be there will be quality payments associated with that. We're also waiting to see what our new allocation is so we can know exactly how much we can include in those quality payments. It says Elevate has been very stressful. Different people coming out telling our staff 2 to 3 different things and making it harder to manage our centers because staff are confused. So Dion, if you could just email us what the specifics are, when you say 2 to 3 different things, we need to know exactly what those 2 to 3 different things are, and who these individuals are. At this point, you should really just have your coach and your assessor. Now, we have had programs that have reported that owners are signing their program up for Elevate, but not relating that to their director or their teachers. So if you are an owner and you have signed your center up for Elevate, tell your teachers and tell your director what's coming. Explain to them what Elevate is. Explain to them that a coach will be contacting the center. Or if you went straight to your assessment, make sure that they understand that they are going to be assessed. If you were the person that before we do any kind of assessment or coaching, the coach should be reaching out to the center to talk to the center about what the coaching is going to look like. Before the assessment occurs, there should be someone contacting you with your 2 week period for getting your assessments, along with the blackout dates that you can set. So if it's something else, as far as like what they should be doing, and again, with the 2 to 3 different things, I'm curious as to what that is. So if you could just email us, because if it is something that, if our coaches are giving, conflicting information, we need to know that so we can correct that as well. Are 504 plans considered a special needs ruling? I'm not sure what that refers to. I'm not sure what a 504 plan is. At this point, it's the SSI determination or the IFSP or IEP. Okay. Angela answered some others. Let's see. Is it possible to send correspondence to providers when parents have not submitted all documents for redetermination?
No.
No, we do not. The thing is with the child care certificates, you all are our partners in that, but our parents are our clients. It's really it's a confidentiality issue for us to give you information on the parent application process without the parents' express approval. So no, we cannot do that. We'll be allowed to receive feedback from our class observations. We have our scores, but would love more detail. So Courtney, your coach should be scheduling a time to come and sit down and talk to you about your class scores. If you have not had that chance yet, if you'll reach out to your coach, and if you don't hear back from your coach, I guess you can shoot us an email to CC Payment. They'll get it on up the chain, and we'll make sure that we get that time scheduled. Because I agree that that's an important part of Elevate is the feedback from the observations. So after you do get your scores, a coach should be coming out and talking to you about what your your scores were and what that means. Are there instructions on how to sign up for the wait list? If you go to the DCCD website, there's a link to the waiting list. It's just simply the parent puts their name and an email address is all that they have to put in at this point. I'm seeing some questions about specific parents. Again, I'm not, this session, we're really answering general questions about policy. If you have a question about a specific family that did not receive a notification, or if they received notification that they feel that they got an error, so if, for example, if they got a termination notice instead of a redetermination notice, call our hotline or you can email the CC payment, and I've got the 1-800 number and the email address on the screen. Any updates on the TANF funds? So with TANF, right now, the agency is transferring 30% of our TANF to our child care program. I also want to make it very clear, I have no authority over TANF funding. That is a separate division, and that's a separate piece apart from DECCD. I know that the agency is looking at options for using additional TANF money beyond the 30% transfer. But that's all I have to share at this point. If there's additional information, we will share it. Let's see. Again, there's some comments just about it being stressful with the cutback. I get it. I completely get it. That's again, like I said, the funding, it's an issue that is, it's felt all across the state, and it's also felt all across the nation. Other states, are are struggling. So there's a comment about instead of cutting certificates, did you look at cutting your staff? No, and let me explain why. We have a very streamlined staff, and the salaries, the funding that goes for paying for staff does not eat into childcare certificate money. The funding that is used for DECCD staff does not cut into certificates. So that would not have made any difference. And we have a very streamlined program. Angela, how many eligibility folks do we have for the entire state that run child care certificates for parents?
10.
10. So we have 10 workers that basically serve the entire state. And those 10 workers handle all the many thousands of applications. So no, we did not consider cutting our staff. Our staff are very valuable. They provide a very important service, and that would have not made any beneficial changes. So the question is, we'll have to wait until October 2026 to receive additional badges. No, that's not true. Or that's not the case. I'm sorry, I shouldn't have said that's not true. No, we're working on getting the second round of badges ready, to allow y'all to work towards earning those. We are focusing on making sure that centers are getting that first badge because again, it is the requirement to continue to operate in the program. We will be launching the second round of badges, the year two badges. We did know, that there would, likely be we might need to delay some of the rollout of Elevate just because it is a brand new system. We don't want to rush anybody through it. We want this to be as positive as an experience as possible. We want it to be helpful, not hurtful. And so that's why I've said, we're watching the progress of the coaching and the assessments. And, like I said, we will be sending out notification that we are going to extend the deadline for that first badge. But no, we are going to hopefully in the next few weeks have it ready for y'all to start working on those year two badges as well.
Hey, Chad, I can't
Yes.
remember where the chart is for the subsidy pay. Is Patty Rasco had asked that question up
Mhm.
earlier. It might have got skipped.
Okay. I believe the copayment chart
No, I think it's under the market rate survey,
for what's
subsidy pay. per room age?
Yes, that's correct. So if you'll go to reports and archives on the DCCD page, there's a market rate survey link. It's the full report. If you'll pull up that report, it will list all of the reimbursement rates. It's by age group. Um, it's by county classification, and it's also by part-time, full-time, and family child care and non-residential child care. Okay. So Regina, thank you for clarifying that. The 504 plan special accommodation similar to an IEP. Thank you for clarifying that. At this point, no, we're not accepting the 504 plan. I need to look into that some more to see exactly what that is. But as of right now, it's just the IEP or the IFSP. Let's see. So Courtney, you said your coach had only had the actual score, no further information. There is once the report is available, your coach will have the full information, um, the full report information. So um, they should be able to go through the full assessment, the with all of the different dimensions and each of those pieces. Again, if nobody reaches out to you in a couple of weeks, let us know and we'll follow up on that. There's also a comment about the center being observed. Yes, that is something else that we're aware of, that, we do only have 12 assessors. That's all we could hire with our current pins with the state personnel board. We're looking at some ways that we can get some additional assessors on board. We may look at contracting some assessors, et cetera, because I do agree that we having assessments so far down the road, it does pose a potential problem. But the other thing that I do want to say is, with the class information, class is not highly technical. The information in class, most of it is best practice, and you can score very well on the class just by doing what we know is best for children. So the interaction piece, talking to children, reading to them, like with infants and toddlers, using diapering and feeding as times to talk to kids, just those basic things that we know as part of child development and early childhood education. Y'all just keep reiterating that to your teachers. If you have, even when you have turnover, I mean, those are essential parts of their onboarding. But yes, I agree that we do, the list of the length of time to get assessed is getting longer. So we're looking at how we can solve that solution. Yeah. So there's a question about Elevate staff just popping in. Um, so your coach, if you are scheduling coaching, your coach should be scheduling days to come do your coaching with you, and they should be working with the director on scheduling the coaching days. For your actual assessment, what happens is that you will get a phone call from our assessment coordinator, and they will call and they will y'all will determine, they'll give you a 10-day period, a 10-day, like a 2-week, 10-day period. So, like a Monday through Friday. And in that 10-day period, you can set, it's three, 2 or 3 blackout dates. I just had a memory lapse.
3.
3, that's right. Thank you. So in that 10-day period, you can set 3 blackout dates. What that means is in those 10 days, you can say these are 3 days that I do not want the assessment to take place. And so in that 2-week period, there are 7 potential days that the assessor will come to your center. So I'm seeing we're actually at time. Let me run through and see if there's any other application or any other questions that I need to try to answer that I have not answered. Again, if you have if you have a question that's specific to Elevate or specific to your center, just send an email to the CC Payment or call the hotline, and we will look into that and get that corrected. Let's see. I will. There's a thing about there's a thing about putting Elevate on hold. So the thing is, with Elevate, we're extending the deadline and being very mindful of that. Elevate is not just the assessment. Elevate is also the training, the coaching, all of those pieces as well. At this point, I really don't see a reason to put Elevate on hold because, I mean, the the process of your staff getting training, that's something that you all said was a problem. You had new staff that were coming in, trying to help get them trained, et cetera. Um, you know, I mean, I feel like at this point that it's more helpful than harmful. If there are other, specific things that are, contributing to it being burdensome, you can share those, with us, and we will consider how we might change direction. But Elevate, I really don't see a reason to pause it right now because again, it's all the training, it's all the coaching. It's not just the assessment part. Um, and I don't really know how pausing Elevate would lead to making the funding issue better. Funding for Elevate is completely separate money. We're required to use 12% of our CCDF money on quality activities. Pausing Elevate would just simply I mean, it's not going to contribute to more funding to the situation. So, anyway, but I am open to more discussions about how to, make the process if the process is difficult. I do appreciate the feedback that you've all given us about getting in touch with your coaches, the scheduling issues. These are logistics things, and we know these are things that we need to be aware of, and we need to work with y'all to iron out all the logistics issues to make the process more smooth, and we are committed to doing that. But at this point, no, I do not see a reason to put Elevate on hold. The other thing that we also need to be very aware of is people are making or looking very closely at childcare right now regarding funding. And our legislators have made it clear that they want some assurance that childcare is it's not just care, that there's also an education component as well. Elevate is probably one of the best ways that we can show that we are aligning learning standards in our early childhood programs um, in a way that prepares children to enter kindergarten, first grade, and up. And so, again, at this point, I really don't see a reason to pause those activities. Making it easier, streamlining the process, absolutely. Let's have those discussions. But discussions as far as just completely pausing it, no, not at this point. Okay, with that being said, we are actually beyond time. So I appreciate you all joining us today. We are the recording of this should be available on our website in the next few days. So if you want to go back and rewatch, or if you know someone that wasn't able to join, if they want to, if they want to watch just to catch up, they can. I appreciate you all being on today. If things come up about individual families, your individual centers, please contact us. We will look into it. I guarantee you. We'll work with you all as much as we can to try to fix any issues that happen. So, y'all keep up the good work. Hopefully, y'all, we will see some light at the end of the tunnel, and we will, see some reprieve with some of the funding issues that we've got. So, thank y'all again for all that you do, and we will see you next time.